So P53 is the most commonly mutated gene in cancer, and P53 is a tumor suppressor that occurs, as I said, very frequently across solid tumors, but there are hotspot mutations, and one of those is P53 Y220C. And so P53 Y220C is present in approximately 1% of solid tumors, but has a very unique property in that it confers a unique conformational change that is amenable to small molecules that can restore the TP53 function. And several of these TP53 Y220C reactivators are in development. Despite the emerging evidence that TP53 Y220C is a therapeutic target, the clinical pathologic features of patients that have these tumors remains poorly understood. So we really set out to describe the landscape of P53 Y220C mutant solid tumors at our institution, Memorial Sloan Kettering Cancer Center, to get a better sense for who these patients are that have this potentially new targetable alteration. So we looked retrospectively at patients with P53 Y220C solid tumors from Sloan Kettering from July 2014 until March of 2024. And we used paired tumor normal next generation sequencing using MSK-IMPACT, which is a hybridization capture-based next generation sequencing assay that detects mutations, copy number alterations, and selects structural rearrangements. And then clinical pathologic data, including sex, age, stage of diagnosis, race, cancer type, were extracted manually from the medical records. Additionally, we looked at the genomics and did a deeper dive looking at allele-specific analyses, like using a computational method called facets, where we infer purity and ploidy corrected for integer DNA copy number. We looked at characteristics in solid tumors and compared the genomics of our P53 Y220C alteration to other P53 missense mutations, to P53 truncating alterations, complex alterations, and in addition to TP53 wild-type tumors. Looking at our demographics of our population, there were 498 patients that we identified at Sloan Kettering with these P53 alterations. About 2/3 were female, most were white. The most common tumor type was ovarian cancer. So about 22% of our cohort had ovarian cancer, followed by pancreatic cancer and 11%, and breast cancer and about 11%. The distribution of the P53 mutations were relatively similar across the different disease types. However, what we did notice was that in ovarian cancer, there actually was a slightly increased proportion of P53 alterations that were P53 Y220C. So looking at the raw numbers, the P53 Y220C alteration was present in greater than 4% of high-grade serous ovarian cancers, whereas it was typically on the order of 1% or lower in other solid tumors. We looked at this P53 Y220C alteration and compared it to, as I said, other missense mutations, truncating mutations, complex genomic alterations. And what we found was that the fraction of the genome, I think, really broadly speaking, it was very similar in terms of the patterns we saw from P53 Y220C compared to the others. So the fraction of the genome altered, the tumor mutational burden, whole genome doubling, loss of heterozygosity, biallelic inactivation, and clonality was all pretty much similar no matter which P53 alteration you were looking at. There were some differences compared to P53 wild-type cases. If you look at the co-alterations similarly, you see that the co-mutational pattern, so looking at the RAS pathway, the TGF-beta pathway, the PI3 kinase pathway, and then even drilling down to the gene-specific level, you see that the co-alterations observed with P53 Y220C are very similar to the co-alterations observed with other P53 mutant cancers. In some cases, that's very different from the P53 wild-type cancers, which you might expect because, for example, in endometrial cancer, there are different molecular subtypes, and P53 altered endometrial cancer is categorized into a subtype that is much less likely to have things like alterations in the PI3 kinase pathway. So the results that we saw were in some ways expected, but there has been a question of whether these missense mutations could also have oncogenic functions and whether they might behave differently than the truncating, for example. So I think this really does add to the body of literature about P53 specifically, and it's really the first ever landscape paper looking at P53 Y220C patients and understanding, who are they, what kinds of cancer do they have, what are their clinical and genomic characteristics. So research is ongoing to determine the natural history of P53 Y220C mutated cancers and whether this biomarker has unique predictive or prognostic implications, and we hope to continue this work.